So Julius, thank you for joining me today.
Certainly.
It's so great to see you.
Yeah, well, thanks for having me. It's an honor to be here.
So there's been good and bad news lately around colon cancer. What is going on?
Yeah, certainly there has been a sort of mixed bag of things with colon cancer recently. When you look overall, we have seen improvement in terms of the actual incidence and prevalence of colon cancer. We know that has a lot to do with what we've done in terms of screening. And we've seen a decrease in terms of colon cancer deaths as well. But those benefits have not been equal. Certain populations, unfortunately, particularly communities of color, we've not seen the same benefit in terms of the degree of improvement in terms of colon cancer. And also, we do see more colon cancer in younger populations as well.
Well, that has been a headline lately. And so what do you think is going on, particularly in that young population?
Yeah, we're still doing some research to really understand exactly what's causing this. We know probably diet, things like obesity, the prevalence of alcoholism and alcohol consumption in those populations, particularly younger populations, may be contributing factors. We're seeing obesity really show up in children now, and how that translates into colon cancer earlier on in life is unclear as well. But we think those are some of the factors that are probably contributing to why we see it so much, in such earlier ages.
Yeah. So I noticed you have an appointment in the Department of Sociology. How does that inform your work?
It really does help me understand the impact of social determinants of health. So when I approach my patients, when I think about how I treat my patients, when I reflect on the best ways to treat my patients, I have to take into consideration the various factors, status, their socioeconomic status, their income, their education, how all these factors contribute to their ability to be healthy and live healthy lives and have access to the healthcare resources that they need.
So certainly when you talk about some of the statistics in colon cancer, it does highlight real issues in health disparities. How do you use that information, whether you're thinking about prevention, treatment, engagement?
We use it quite directly in my work. As a medical sociologist, I actually study the impact of social determinants of health on various health outcomes, including colon cancer. And specifically here at Duke, we actually have a number of initiatives and grants that we are working on right now to address this issue. We have a grant where we're working with the community to understand the impact of non-invasive tests and how well we can leverage things like FIT testing, which allows us to understand how we can get that in the communities and get people access to some type of colon cancer screening. And then we also have another grant around health literacy, where we are working with the church community here in the Durham area and actually in the southeastern United States to think about how we can do a better job of communicating and educating populations about the importance of colon cancer screening.
So you've touched on this a little bit, but obviously you advocate for communities of color, particularly at the intersection of health disparities and our communities. Why is that so important for you?
Yeah, that idea of how you can build bridges with the community is so important, and building that trust really helps us as physicians, helps us as a health system do a better job of providing care for the community. And as an African-American male who's a physician who understands, what it's been like for this community, the barriers that exist within that community, I think I'm an important tool in terms of how I can be a bridge between the health system and the community and sort of bringing us together so we can ensure better outcomes for everyone.
So I can say I knew you when.
That's right, you did.
When you were beginning your career.
That's right.
And I'm so proud of the work that you're doing and the work that's being done at Duke within our community, and thank you for all of it.
Well, thank you, and thank you for your support.